We won't stop until we get every person in Ontario, until we get every worker in Ontario back to work and back on their feet. But today's news is an important step forward. It's an important step in getting life back to normal, and this will mean expanding the limits on public gatherings in regions as they enter Stage 3.
CBC's Megan Fitzpatrick joining me live at the Ontario Legislature. Okay, Megan, let's dive into this. What is going to be allowed to open up?
So, as you heard the Premier say, nearly all businesses and public places will be allowed to open again, with some exceptions, though. There is a list of what has to remain closed in Phase 3. And those things that are allowed to be open, a lot of them will be subject to certain restrictions, Ash, and those include the size of public gatherings. So the Premier there, just talking a little bit about that, the size of gatherings will be allowed to go up to 50 people for indoor gatherings and 100 people for outdoor gatherings. So what that means for places that are reopening, like gyms and fitness studios and classes, they'll still be capped at those numbers, Asha. They'll be allowed to open, but people using those facilities still need to maintain physical distance. Same thing with the other places that will be allowed to open, like bars and restaurants. People will be allowed to have a drink or a meal inside, but again, tables must be 2 meters apart, for example. People have to remain seated at all times. So in the bars, no standing up and mingling around, and no dancing. So nightclubs not allowed to open unless people are just sitting down to have a meal or a drink, Asha. Parents want to pay attention to this. Playgrounds will be allowed to open in Phase 3, finally. Sports leagues will be allowed to resume, but again, no prolonged physical contact between participants. It specifically says in the documents, Asha, no wrestling or judo, but other team sports, for example, will be allowed to go ahead. Movie theaters allowed to open. Live performances, small concerts, those are allowed to resume as well. But again, all of these restrictions have to be adhered to as well in terms of spacing people apart. The government saying at that news conference, Asha, just because businesses can reopen doesn't mean they should if they're not prepared to follow the rules and the restrictions. And again, businesses are still being encouraged. If their employees can work from home, let them, if it's possible, still maintain that. Just to go over a few things that aren't allowed to reopen in Phase 3, amusement parks still not allowed, water parks not allowed, buffet restaurants not allowed, still no overnight camps for kids, Asha. And then other restrictions, like casinos are allowed to open, but no playing at tables within the casinos. Now, there is an exception to this as well. The government's saying if one of these businesses that's not allowed to reopen in Phase 3 can come up with some kind of plan to prove that they can open safely, they might be able to get special permission from the Chief Medical Officer of Health.
Right. I know there will be a lot of people who will be disappointed about the dancing part of that.
You can't get a facial, though, now, so maybe that'll make up for it. That's allowed now under the personal services category. But no dancing.
Yeah, no dancing. And also what will be tricky is, say, and I know this was discussed in the news conference, but opening up movie theaters and only allowing 50 people inside there.
The entire facility.
Yeah,
yes.
it's going to be really tricky and interesting to see how this all works out. CBC's Megan Fitzpatrick in Toronto, thank you.
You're welcome.
For more on this, I want to bring in Dr. Suman Chakrabarti. He's an infection disease specialist at Trillium Health Partners. He is joining us from Mississauga. Let's start with Ontario. Hello to you, first of all.
Hi there.
Hi.
Thanks for having me.
Let's talk about Ontario. And I mean, there's so much to really dissect, but Ontario is in a position to open up. So what are your thoughts on that?
Yeah, this is a big step. You know, I couldn't even imagine this back in March when we were first entering the big part of this outbreak. But it's awesome to see that we've gotten here. Obviously, it's something that we have to do carefully because if we start to see a surge in infections, things would have to be pulled back. But I'm glad to see the system's working. We are really doing a good job of tracking and tracing. And also, it's being done in a regional way. I agree with the fact that areas like Toronto and Peel are not yet entering Stage 3 because there's certain situations here that are not yet completely under control. And we want to see that when we're moving to the next stage. I think this is being done in a good way, and I'm happy to see that we're finally at this stage.
And this time around, Ontario is saying what can't be open and what can't be done rather than what can. like a lot of those things, activities, places where we're seeing outbreaks in the U.S., as I'm sure you're familiar with, dancing in the bars is a no-no, table games at casinos, amusement parks. What do you make of this approach? It's sort of a piecemeal approach.
That's true, but there are certain things that are a much higher risk. And when you start to get into these areas where you have, constant prolonged contact indoors, that's why things like, the table games at casinos, karaoke bars, we know that singing is a high risk, especially indoors, for transmission of the virus. And the other big things like concerts, sports venues, festivals, these things are likely not going to be seen at all until we get the vaccine. So there's still certain things that we're not going to see in stage 3, but a lot of it will be moving towards some semblance of normalcy. And, I can't wait for Toronto and Peel to be in that situation, because it'll be nice to see all that again.
And, let's talk about prolonged physical contact, as you mentioned, and sporting events. That's not the case for NHL. Teams obviously seem to be getting back into action, coming to Toronto for the playoffs. Do you think that's looking like a double standard? We also know the NBA is starting to get back into action with their bubbles.
Yeah, the thing is, when I look at these different sports leagues, obviously there's some differing opinions on this, but I think the NHL, the bubbles, the hub cities in Edmonton and Toronto, these are two situations where I think that it's actually thought out very well, and it's worth trying, especially in areas where we know that right now the COVID transmission is very low. The other sports leagues, though, that are happening in places like Florida, and they're flying all over the states, I'm on that one. I'm a little bit worried about that, especially given what we're seeing there with the vast number of cases in just Florida, 15,000 cases in one day yesterday that we saw. So I'm much more nervous about those ones. But I do think the NHL is at least worth a try. If it doesn't work and we have to pull back, well, then that's be the case. But it's at least thought out, and it seems much safer.
The Ontario government also taking a regional approach here, pretty much everywhere entering stage 3 Friday, except some particular areas. We're talking about the Golden Horseshoe, southwestern Ontario, where, as you know, we've seen the larger outbreaks. Do you think that regional strategy has been working, and will it continue to work as more things open up?
Yes, at this point in time, we know that Ontario is a huge place. Canada is a huge place, and we know that things can be vastly different. There's been hardly any cases in Northern Ontario, even at the peak. So it makes sense to look at these things in a region. We also have to think about other things. For example, my home town of Sarnia is a border town, and they have a big casino there, and there could be the issue of people coming back and forth across the border, which can, of course, be a big concern given what's happening down south. So the regional approach is one that I think is what we have to take, and you have to look at each thing on a case-by-case basis and respond accordingly based on the circumstances.
And some may think, even with this measured approach, that it's too soon. What do you say to those people who are a bit worried about all of this?
There's always going to be concerns. And I think that we have to keep those concerns in mind. We have to debate about this. We have to talk about this and constantly reevaluate. But I want to say one thing to Canadians that's very important, is that in the phase that we're at right now, we expect to see cases. That's the point, that we are at a situation where we have this under control. But if we see cases, it means that we're tracking and tracing them quickly. We have these small fires, and we're putting them out before they become a big one. And that's going to be the normal situation for the next several months until we can get a vaccine. So remember that when we see some cases, that is an expected thing, and that means the system is working, and we're going to be seeing this until the vaccine comes about.
Getting back to school in the fall seems like it's going to be complicated, and we don't quite know plans and how that's all going to roll out. What do you think school should look like?
Yeah, this is one that I don't have a great answer for. It's such a difficult situation. There's so many different things to consider, and this, not the least of which is the mental health and the development of our kids and adolescents. So, I do think that my personal opinion is that the school should open, and if we have a low enough amount of transmission in the community, I think it can be done safely, but it has to be monitored very closely. We do have a lot of evidence that shows that children and adolescents they don't get as sick with COVID-19, and they don't spread it as easily. But that said, again, we have to consider very, very closely the way we set up, for example, the desks, how close people are in contact with each other, and how we're going to be doing the testing. It's a complicated situation. It's being monitored every day, and September is just right around the corner, so it has to be done quickly.
Yeah, and a lot of parents, it's hard for them to get back to work, obviously, if kids are not in school. Do you think that 1 week on, 1 week off proposal would be something to consider?
I saw that and I thought that it's a really creative idea. I don't know how it would work in practice, but these are the types of things I think that will be what the solution ends up being. And it could even be a phased in approach, even doing maybe the 1 week on, 1 week off. And then once you see that there's no transmission, then increasing it back to something that's more close to normal. But there are some projections that we might be seeing a vaccine here sometime even as soon as the end of 2020. So, some of this might be helped by the fact that there'll be some type of protection that will be available when the vaccine comes along.
Let's turn to Quebec. There's an announcement today that Quebec is mandating masks in all indoor spaces that the public has access to starting Saturday. Should this order have come earlier, in your opinion?
Yeah, I think that in general, we know that masks work the best in these situations where you can't physically distance and you're in an enclosed space for a prolonged period of time. For me, whether it's a mandate or not, I think the biggest thing that we want to see is that this is normalized. The behavior of wearing masks in these situations is something that we're all considering doing, and it's something that the majority of us do. So whether that's with a mandate or not, I think that the best thing is that the messaging is out there. People are going to be wearing a mask in indoor spaces, and I'm seeing this happening all over Canada already. So we still have a ways to go, but mandating is one way of doing it, and I think whatever normalizes it and gets this tool in the places it needs to be is something that's going to be very worthwhile.
Appreciate your insight. Thank you.
Thanks so much for having me. Take care.
Dr. Suman Chakrabarti, he's an infection disease specialist at Trillium Health Partners, and he's joining us from Mississauga.